Yes, thanks, Kemi. The challenges that we faced as healthcare providers, I think, cut across most sectors. With the lockdown and the uncertainty and the fear, we had quite a number of things that affected access to healthcare. So people could not move. I work in a very critical area of HIV and infectious diseases. So, the moment you cannot access care, it is easy for you to fail to suppress the virus. And then the challenge also is that most of our patients have what we call non-communicable diseases, things like diabetes and hypertension. So our approach as an institute and as the mandate of healthcare workers is to treat people holistically. Like, we can't just treat a disease in isolation. We treat them to the ability that the entire body is up to super function. And so with the other factors coming in because of the lockdown, it became really, really hard. And we've been having redundant conversations of adopting technology, making infrastructure quality, and then access to internet, digital literacy. All these have been very redundant conversations. So you go to rooms, you talk about all these things, embrace M-Health, do the whole embrace public partnerships to propel the conversations, to make sure you implement sustainable, affordable, equitable, and inclusive digital healthcare platforms. Because the reality is, with technology, some people can be kicked out. So the fear has always been the urban and peri-urban people who have access to internet and internet supported devices would ideally benefit from anything that is digital. And so the challenge has always been, how do we innovate in the context of our population to the last mile? How do we leverage technology for the last mile? And surprisingly, with the pandemic came the shock that we actually shouldn't have had these as redundant conversations, but we should have actively, taken them up and implemented them. You would see that even the ministry was having shift in how to embrace these technologies so that they can have proper resource allocation, but then also try to protect the healthcare workers. So how do you embrace technology that you have been redundant to implement at a point where you need to implement it? So everything was up in high gear. So because at IDI, we have an innovations academy, and we've been, iteratively developing our technologies with, this in our minds, like, how do we leverage technology for everyone? So at the point of the pandemic, we had to reduce patient, doctor, or clinician interaction, meaning we had to come up with models of how we're going to deliver medication and continue clinical care for clients, maintaining SOPs. So we had to come up with very dynamic and flexible ways of still maintaining care and adhering to SOPs. So we decentralized access to care, we geolocated our clients where they were, but importantly, because we had in our pipeline some of our technologies to support healthcare to the last mile, we now had to activate them immediately. And our approach has always been, we need to build flexible technologies that can adapt to any situation. So once the pandemic hit, we had some systems that my group and that my team has been working on, and the ministry gave us a chance to pilot this technology. So we've been supporting the ministry in following up with clients with COVID, those who are at high risk, those who are in isolation, those who have been post-discharge from COVID treatment units, and were having all this stigma to set up into communities. So the systems that we developed were centrally following them up, and they did not need, having a smartphone. So any basic phone could actually get you the service. So it was an opportunity for us to test the hypothesis that we have been having regarding our technologies, and for us to have the impact of following up more than 20,000 people, contacts to positive cases, discharged clients, those in quarantine. There's been an overwhelming experience because at the point where we didn't kind of have clarity on if this would ever be adopted to scale, we were called on to scale it up immediately. So as the rest of, everyone else was trying to, keep indoors, my front line was now a version of both clinical and then tech. How do we combine the two? And we had to literally drop everything else we've been doing to make sure we now support the response. It was very overwhelming because you have the technical things going on, but then you also have the operational side of, the response. And you have to make sure you keep the balance of keeping yourself safe and your family and everyone else around you safe. So it kind of, made me think that we as leaders in the positions that we are in, we need to be really very intentional, because I personally am really, it gets to a point where you're tired of having redundant conversations, especially when you see something that has impact, when you see the trends of healthcare service delivery changing and you're not willing to adopt to them, or you're not willing to actually take them up at the moment where you need to have them, it becomes very expensive for you to activate them to the scale that they should be responding to. So it's been overwhelming, but 2-3 months down the road, we stabilized, and we're thinking now what we could have done better, how to have better stakeholder engagements for everything, from ideation to piloting to scaling. Yeah, it's been really a challenge, but intentionality has to come from leadership, and technology must be very inclusive, because we risk leaving so many people out. How many can afford to be on a Zoom call in your village in Fort Portal? How many? What version of Zoom can we create for your folks in Fort Portal? So if they're already having challenges going to the nearest healthcare center, and now you're introducing technology, how are you going to impact them with technology? So all these have to go into the thought processes. You need to understand who you're innovating for. You need to understand the systems have to be robust. They have to be very flexible. They have to be very scalable, and they have to communicate, because data access and, that vertical communication of, I'm from this health center, I have this, if I go to Kampala, I can still access my services. So that was the challenge that we were in, because people are caught up in the lockdown in different districts. And, as per the healthcare structures, if you receive care, let me say HIV care, in a different hospital, you're literally attached to that hospital. What happens if you're in a different district? So how do you create systems that can push the information to the other system in the different hospital and still make it possible for you to access your care? So in the grand thinking of all these, adopting technology, we need to get back home. We need to get back to our people. We need to think critically through what people exactly need and what's the nature of our society and environment. Because with this whole excitement of technology, it is very easy to leave people behind. So intentionality from leadership and thinking around our environment is very critical. Yeah.
That's amazing. And real quick, it's just funny to see parallels, because when you speak about intentionality and who you're accessing, in my world, it's your audience. Like, who are you writing the story for? So in your world, it's who are you creating these systems for? What's
Exactly.
mind blowing to me is a lot of your systems, not just you, but like everyone that we've spoken to, it feels like you almost knew this crisis was coming, and I know you didn't. But it's like these things you've created are so well suited for this moment. And I think sometimes we get ideas and we don't act on them. And so we wait for the crisis and we're like, oh, I have an idea on how to fix this. What was the thing that pulled you to doing this and took it out of an idea and made it a reality?
So personally, I would say that when I was starting out in my medical practice, again at IDI, I felt there was a shift in how healthcare is going to be accessed by people, and this was, technology coming into the space. Like, how can I continue seeing someone remotely, and I started to think about how to embrace technology in our context. So I haven't just started now, even way before this department was started at the institute, there was that understanding that things are going to change and they're not going to be very traditional. And so I need to be intentional in aligning myself with, the people, the knowledge, the networks too. Because innovating for healthcare is very, very hard. The dynamics of healthcare are not like, fintech. The building blocks are very, very complicated. So you need to be well prepared to understand how to navigate these different blocks so that we can create a system that is adaptable and will have impact, not just the satisfaction of I've developed an application and only few or 10 people in an urban setting can have it. So it comes from my experience working in the clinic, like being an actual clinician, that these are the challenges that my patients have, even coming to see me in a doctor's room. So what happens if you take away the doctor's room? How can I continue if I'm not in my doctor's room? So being a clinician informed and relating to the challenges informed the way I approach and appreciate technology. It doesn't have to be super complicated. It has to be to the simplicity of the person that is going to use the technology. So it's my clinical experience with people that actually informs, how we need to appreciate and use technology. Yeah.
That's a great wrap up to this, because I think initially, as I said in the beginning, I do believe that sometimes when we see crisis, we hyper focus on what's lacking. But I think if we start to look at it as what's missing and how can I provide to that, I think as leaders, we will inspire more leaders who will keep doing that.
Yeah.
I've talked enough, so